with the legislature. Give me your over-under. How tough is this going to be to get your colleagues in the House and Senate to go along with?
Well, they're great partners, and I'm great to see 3 of those partners with me tonight. This is a tough thing, and I won't avoid that, but the point is, over the last 2 or 3 years, we've done a lot of tough things. And isn't Michigan better? Because we didn't ignore problems that were problems for 10, 20, 30 years. We took them on, we solved them. We've moved forward in a positive way. This is just another instance of that. Let's solve this one. Let's be proud, and let's keep Michigan going up.
Let's move to the next subject, which is something you brought up yesterday, the expansion of Medicaid in the state. This becomes complex. It also has another pretty good price tag with it. Let's find out. I know there are folks in the audience that have health care issues and questions. If I can, you are Wayne Wilson with Priority Health. And if I recall, one of the things you said when you emailed us, you wondered about that expansion of Medicaid. What would you like to ask the governor?
Essentially, Governor, we support the expansion of the Medicaid program. However, adequate access continues to be a challenge for Medicaid beneficiaries, and I'm wondering what thoughts or ideas you might have on how we can overcome that challenge and perhaps the stigma associated with Medicaid beneficiaries.
Well, thanks, Wayne. And Priority is a great organization that does great health care work. Medicaid expansion gets back to the fundamentals, and you mentioned some. Cost, quality, and access are the 3 key words in good quality. This is really about creating a situation where we lower costs and provide better service. Because let's talk about it, because in many cases, again, this is a case about saving money when you get all the facts. It's like the last situation. Too often you only get part of the story, so we don't see the real value. So if you go to this case, think about, right now we've got hundreds of thousands of uninsured people. They're going to the emergency room. It's not free, and you know this in your organization. It's called uncompensated care. Your organization's eating it, the state's paying for it in some way, or it's getting in all insurance premiums. So it's being paid for, it's not free. And so if we keep on doing just ER visits, that doesn't work. The question is how do we get them in a medical home model with a primary care relationship and actually save money? Instead of being uncontrolled and unmanaged, let's move to a managed system where basically we can say they can get a physical now, they can get immunizations, they can get lower cost treatment, and they can avoid the ER. The quality of their life goes up dramatically. Hopefully they'll be able to work more, less absenteeism, better health, better family life. From a societal point of view, instead of hiding that cost, that's a huge cost, we're being more upfront to say, let's manage it, let's know how to do it better, and let's work harder on better management. Because that's one thing this whole situation doesn't resolve. I think we need to do more on wellness and get us to be healthier to begin with. And you've got good programs in your organization, but we need to promote them more. I'm working on it. I still got to lose a few more.
24-hour News 8's Brian Sterling is standing by with another one of those viewer questions that deals with some of the same issues. Brian?
Questions on this topic center on the new federal health care law and the impact in Michigan. This question's from Jen. She says, I would love to ask the governor about his position on accepting federal funds to insure more Michigan residents through Medicaid.
You referenced not only the Medicaid problem, but you also talked about another issue today in asking for a supplemental from the legislature that would deal with health exchanges. And these two issues do play into each other. We can't explain the whole Affordable Health Care Act in the time we have, but try to explain your position on both of those and how they fit together.
Simple questions tonight, Rick. Thanks for asking. But let me try to make it simple. I don't think what happened with the Affordable Care Act was the best answer for our country. That's not what I would have pursued. Why do I say that? Because it was too much about insurance and coverages. It's not addressing 2 of the fundamental underlying issues that really drive healthcare costs much more so, and quality of care. Wellness and primary care, patient-centered medical home. I believe they should have been the priorities. I respect the federal government. It went to the Supreme Court. It's the law of the land. In that construct, my role is to best represent Michigan. So my view is the best answer we can do is let's do the healthcare exchange right. Let's do it well. And that's why we ask for a state partnership exchange instead of a pure federal exchange, so we can keep the customer service piece with Michiganders. And we can listen to your issues and feed those back to the federal government. On Medicaid expansion, I view it as about saving money. It's about unmanaged, uncontrolled costs that we're paying in some fashion, whether we know it or not, or doing it in a managed fashion where we can look to primary care again. and a medical home mile. That's a huge difference. One other thing I'll share with you that I think is important that we are thinking farther out is in the near years, it actually saves the state of Michigan money because the federal government will be taking off costs that Michigan otherwise pays out of our general fund. So we're going to save about $200 million in the first year of this. Well, again, I don't do things just to take money. It has to have an advantage for Michigan customers. We're going to reserve, the goal is to reserve about half of that in a health savings account. Now, many of you, how many people have a health savings account in some fashion? Quite a few people here do. You use a health savings account to say you're going to pay co-pays, deductibles, unexpected medical costs. So we can, if we do half of the savings, and we do that consistently, when we have to start doing our co-pay, which happens in several years with the Medicaid expansion, we would have enough dollars saved to cover us through 2034 before it costs Michigan citizens anything. That's a huge thing. Secondly, if there's unexpected things, the federal government changes the rules, and again, I don't want to take that for granted. I appreciate that question because it's a real risk. We've built up a major account to cushion any shocks or major unforeknown circumstances, just like an insurance policy. So I view it as, let's buy some insurance while we do this that we can use for good thoughts in the future, just like a health savings account. This is a good idea and a good program.
And I should just to clarify, you asked the legislature to pass a supplemental expenditure that would allow you to spend grant money that has come back from the federal government that you can't spend without their permission.
Yes, it's $31 million to do the healthcare exchange. And the bottom line, people say, well, what happens if that doesn't happen? We need to spend the $31 million and it'll come out of general funds. So that money needs to be spent to comply with the law. And I don't know why we wouldn't use the federal dollars that they're trying to give us and instead take it out of dollars here that we're using for great things to help Michiganders.
We've just talked about two big issues that you brought up in the past 24 to 36 hours that deal largely with budget items and overall big policy. I want to talk about another one that has been resonating in this state for at least the last 60 days. When you were here a year and a half ago, you got a question from somebody right over here, and they asked you about right to work. You told them then what you had told me and continued. It wasn't on your agenda. The circumstances changed, the landscape changed, all of which you can talk about in a moment. But I want to find out from this crowd if there's anybody in here that has a question about right to work. Can I get you to stand up, sir? Your name is Pastor Nathaniel Moody. You are from Brown Hutcherson Ministries. Thank you for being here. What's your question?
Thank you. Thank you, Governor, for being here. My question is the state of Michigan headed in the same direction as Mississippi and Alabama with the right to work laws, which have affected unions and possibly affecting the wages of people at this point in time in those areas?
Well, I appreciate your question, Pastor, but let's put it in perspective. Michigan was not a right-to-work state, correct? Yes. What happened in the last decade? We lost 750,000 jobs. We lost more jobs than Mississippi or any southern state you can think of. You probably could add most of them up, and they still wouldn't get to the number of jobs that Michigan lost, and we were a not right-to-work state. So that's not the key driver here. Also, sometimes people like to talk about income levels, and there's a lot of misinformation out there. To put it in a simple context, to look at the big picture on this issue, I didn't go looking for this issue because I believe there were higher priorities that we needed to be working on because it is a very divisive issue, and we saw that. And in fact, what happened? Summertime came last year, and a number of people in the labor movement decided they want to move forward with Proposal 2. That was a dramatic overreach into Michigan's Constitution regarding collective bargaining. And before they got on the ballot, I actually went to them in a very public fashion and said, please don't move forward with this. Because if you bring up this issue and you start this dialogue, you're going to bring up all the right to work issues, you're going to make all these different topics, and it's going to make Michigan very divided. They ignored that. They went ahead and put it on the ballot. Citizens saw, our customers saw that was a bad idea. It got defeated. And what happened when it was done? Right to work became a very divisive issue with people fighting about it. Now, since it was on the table as a divisive issue, you hired me to make decisions, to represent Michiganders the best way I could. And when I looked at that issue, my view is, it's here, it's not going to go away. Let's make some decisions and let's move on to other issues again. And when you look at the issue, to be blunt, I'm going to take the workers' side. It's an issue between workers and unions. And I believe in hardworking Michiganders and giving them the freedom to work and make the decision, do they want to join or not, with their hard-earned dollars. And I believe that was the right answer. Not everyone agrees with that. But the second piece that was also clear, because there are so many competing studies, is Indiana did something similar sometime before us. And it was very clear that more jobs were coming to Indiana by being a right-to-work state. And the bottom line, one of the things you hired me to, you hopefully made that call, was it was to bring more and better jobs to Michigan. And I believe it will bring jobs to Michigan, and it's having positive impact in terms of people being interested in Michigan already. So it's a topic that I hope we can agree to disagree in some cases, but understand it wasn't out of looking for a fight. It was about solving another problem to move forward so we can get to these other important issues that we've been talking about. So thanks for your question.
Let's talk, stand right up. Let's talk, and I want you to be able to do your question, but I also want to move this conversation forward a little bit too, because there is the larger issue of jobs in general. I spoke to each of you downstairs before we came up, and we've been talking about this for 10 years. We've been talking about jobs. So I know you have a question, and you are Betty O'Connor Rogers. You're a registered nurse.
Yes, and thank you for the opportunity, Governor. I'm a mother, I'm a registered nurse, and when our state locked our state capitol doors during the lame duck session, I was treating people who were peaceful protesters when they were being pepper sprayed outside. My question is, can you justify the undemocratic way in which right to work and other laws were passed through the lame duck session? Don't controversial bills deserve to have public hearings?
Well, right to work has been an issue in Michigan for years, and it's something we've been talking about for years. So there's lots of time for dialogue on right to work. It's really about freedom to work, and that's taken place in a significant amount of time. And with your question regarding closing the Capitol, that was a public safety issue. That was a decision made by the Michigan State Police. I didn't have any say in that. They made the call based on public safety because we want to make sure people are safe. And it went through a court suit. It was, in terms of the initial reaction, is the court came against it to say it was a bad thing. Well, that got thrown out later when it was really examined and reviewed, that they presented their case and the judge came back and said the Michigan State Police made a thoughtful, well thought out decision to think about the citizens of Michigan and look to public safety. So it wasn't done to anything to discourage dialogue or discussion. It was to make sure you were safe.
We are at a point in the state of Michigan where we are better, Governor. We have more jobs than we did at one point.